Here's the top 5 reasons you never want to have cataract surgery. I'm Dr. Easton Kelsey and I heal my eyes naturally. Maybe you don't have cataracts and you probably won't get them for a long time, but I bet you know somebody who has. A parent, grandparent, someone else in the family. Cataracts are a clouding of the lens inside the eye. Right behind your iris, you have a crystalline lens, and it's about the size of a little M&M, but it's clear. But as you age, it gets more chocolatey. It's brown. Light has a harder time passing through. It changes your color perceptions, and that's just one type of cataract. There's several types of cataracts. There's also the type of cataracts that are like cracks in your windshield. And then that crack just grows one day and all of a sudden messes up your vision. Here's reason number 1 why you don't want to get cataracts. Now, average age of cataract surgery in America is 72. It's the most common surgery. It's tied with gallbladder in America, I believe. But there's 5 reasons you don't want to get cataract surgery, and I'm going to tell you why. Number 1, it's not you or the doctor that gets to choose when you get cataract surgery, when you have cataracts. It's the insurance companies. So you have to wait until they consider them ripe enough to come out, not you or your doctor. There are some exceptions, but for the most part, you don't get to choose when to have these things out of your eyes. Number 2, when you have that cataract taken out, they'll put an artificial lens in its place. And you have to decide what power you want that lens. Do you want your eyes to see as clear far away? Or do you want them to see up close? You want one eye far, one eye near? Yeah, so either way, it's not an ideal situation where you're going to have both eyes seeing far, perfect, or near. They also have multifocal implants, but they just don't give you the type of vision you had when you were younger. You can also get implants for astigmatism. Once again, that's not going to guarantee that you're not going to develop any astigmatism in the future. So, all these lens choices, you're not sure what to pick, and I've seen a lot of dissatisfied patients. Oh yeah, and the premium lenses cost a lot of money because insurance doesn't pay for those. Number 3, it's an irreversible surgery. Once it's done, you ain't going back. I don't know about you, but I don't like the idea of anybody taking a scalpel to my eye. 4, you have a higher risk of issues once you have cataract surgery. The number 1 risk that you have is a retinal detachment. And the reason why, most people when they have cataract surgery, their vitreous body inside is already kind of shrunken down. It may have already pulled off, but if it hasn't, it's more likely to pull off after cataract surgery. Sometimes it actually pulls the retina with it. And why is it a higher risk after cataract surgery? Well, the lens, I said, was like a disc shape like an M&M. The implant's skinny like a Frisbee. So it creates more volume in the eye when the implant's in there, more room for that vitreous or the jelly to slosh around, tug on the retina, and therefore, especially with the aging retina, higher risk of retinal detachment. Number 5. Now, there's some cool things about cataract surgery. It's almost like getting LASIK for some people because they might have a really high prescription and they can take you down to a very small prescription. But for the most part, I would say most patients still need to get glasses after cataract surgery. So why would you want to go through a procedure when you're still going to have to wear glasses for the rest of your life? That's my opinion. So what to do about cataracts? Well, in the 20/20 vision regimen, the 6,000-year-old Dow method of acupressure, breathing, and attention is going to dissolve imperfections in your lens. I'm not going to say it's going to be overnight. You got to be diligent about it. But the other thing is the castor oil in my 20/20 vision regimen oil has been shown to not only help with floaters, but with cataracts. So, what would you rather do? Would you rather take a chance with a surgeon's blade in your eye and see just what happens and hope for the best? Or maybe just never get cataracts. Or if you have them, why not just get rid of them yourself without surgery? That's what I would do. Blessings and namaste.